This is the second video on coronavirus updates series from Reunited Spirits. This video is about the myth and facts about the coronavirus and COVID-19. As you know, and probably you're one of them, nowadays many people are at home and they are surfing internet. And they are part of several different chat groups and social media groups. And they get news from everywhere. After internet, they turn on the TV, different channels to see what's going on. And there are a lot of misinformation and sometimes even misleading information and a lot of confusion circling around on internet and social media and chat groups. So that's why this video is about the myth and facts on coronavirus. Without further ado, let's get the latest number around the world to see what's going on around the world, and then we go through the myth and facts on coronavirus. Okay, so let's take a look at the numbers from around the world on Johns Hopkins coronavirus website, which is updated at 1:21 p.m. and today is April 3rd, 2020. During last 24 hours, almost 80,000 more people got infected. So roughly actually for past few days, it's around 80,000 new cases per day. As you see, the whole world has coronavirus and almost everywhere is infected. Even Africa and even the small islands and like distance places in different places, they are infected with coronavirus. So today, the total cases around the world is 1,083,084 people up to 1:21 p.m. and the number of deaths is over 58,000. Now let's take a look at the US. The total number for United States is 266,671 cases and the number of deaths 6,921. Italy, almost the hottest spot actually with Spain, they are just changing the place. Sometimes even Spain, occasionally it goes to the second place. In Italy, the total number is 119,827 cases and the number of deaths 14,681, and Spain is 117,710 and the number of deaths is 10,935. It is very unfortunate that we have these big numbers, both for infected cases and number of deaths. The mortality rate is different country to country and is different actually in different situations, because we don't know the actual numbers yet, and this is actually one of the items that I talk about that today. Alright, so let's get on myth and facts about coronavirus or COVID-19 disease. This is not a medical advice, this is for educational purpose. As you know, there are a lot of misinformation circulating on internet and social media and group chats. It's very important to spread the positive words and reliable information. I get this information from reliable sources like CDC, NIH, JAMA, the Journal of American Medical Association, and speeches and interviews of Dr. Fauci, Dr. Birx, and other reliable sources. Some people, they think COVID-19 and seasonal flu are similar. Well, the symptoms could be similar, like fever, cough, and short of breath. However, even in this symptom, there are some differences. In seasonal flu, usually the symptoms gets better after day or 5. But in coronavirus or COVID-19, after day or 5, the symptoms get worse in many cases. So if your symptoms are getting worse, it's better to talk to your doctor or seek medical advice from your local health authority. The other difference is in mortality rate. Coronavirus, this novel coronavirus, is 10 times lethal than seasonal flu. The mortality rate in seasonal flu is 0.1%, but in COVID-19 is tenfold, is about even 1.2%. You may see actually different numbers from different countries or different states. This is based on the situation in that area, because first of all, we don't know the total number of infected people in that community. Those cases, they need hospitalization, and that's why in some areas actually you see very high mortality rate. But in general, in total, if you consider the total case numbers compared to the mortality, the number of deaths from this coronavirus, the mortality rate is about 1.2%. Novel coronavirus is the most dangerous virus, which is not. Yes, it is highly contagious and it kills people 10 times of seasonal flu. However, the mortality rate of other viruses or other diseases are higher. Something like SARS, 13 to 14 times of coronavirus, or Ebola kills people about 34 times, because it's 34% or 40% lethal. Coronavirus is airborne. It's very important actually to use the words correctly, and it depends on who is using these words. When you say airborne, people think it's in the air, and if you go on the street, you get infected, which is not true, because the coronavirus are in respiratory droplets, and because this virus is heavy and those respiratory droplets are big in size, they spread about a few feet, like 3 maybe to 4 feet, and that's why the guidelines tell us to stay away from other people more than 6 feet. It's not like measles, for example. Measles, they stay in aerosol, and aerosol are smaller droplets that they can stay in the air for longer period of time. For example, in measles, for measles in 2 hours. But in some other viruses, some other cases, they can stay in the air for about maybe 4 or 5 hours. However, measles is very, very contagious, but this coronavirus is not like that. But we get infected from the droplets that they settle on surfaces, different surfaces. So it's not only a direct respiratory droplets that we get infected with, we get it from the surface, and that's why it's highly contagious. Coronavirus lives on every surface for days. This is not true. It's not on every surface for days. In some surfaces, like for example clots, it may stay there for maybe a few hours. But on hard metallic surfaces like stainless steel, like step railing, especially in cold and dry condition, they stay for a few days. But it doesn't mean if you go to hot and humid area, for example, like Florida, you don't get infected. You will get infected. The rate might be lower compared to cold and dry area. Face mask can protect you over 95%. I think this myth is coming from N95. If you are a healthcare personnel and your N95 is tested and it's fit on your face, it prevents the particles to get through the mask. The particles that they are larger than 0.3 micrometers or micron. But other masks are not like N95. That's why the healthcare personnel, they need N95 mask, and those people who are infected also, and people who are taking care of the infected patients, it's good to have N95. Surgical masks are good also, however, it's not like N95. Masks are not reusable. It was true up to recently, but recently there is a company in the United States that they sterilize the N95 masks up to 20 times. Numbers of cases and deaths are not accurate. Well, it could be true to some degrees, and it depends on the state or country. Most of the numbers are not real numbers because of the situation, because many people, they go to hospital and they seek medical advice when they are sick, they are symptomatic. There are some people, they are infected, but they are not symptomatic. However, it depends on the state or country. Some countries, like United States and European countries, they are transparent on whatever number they get. But some countries, they fabricate the number. So the differences are from different areas for different reasons. Vitamin C and D prevent coronavirus infection. There's a study from Germany that they compared those people who have or had sufficient vitamin D in their body compared to the other group that they didn't have sufficient vitamin D, and they saw those people who have enough vitamin D in their body, the symptoms were less severe compared to the other group. However, none of vitamin C or D or other vitamins that they are useful for immune system, they do not prevent the infection. But it's good to have vitamin C and D and vitamin even A and E and zinc enough to your body. So do not be deficient on these vitamins, but they are not preventive measure, that they do not prevent you to get infected. But it's good to have these vitamins sufficient enough in your body. So if you get infected, the symptoms are less severe. Vaccine against COVID-19 is found. Well, there are over 20 vaccines are tested, and some of them are in phase 1 clinical trial. However, phase 1 clinical trial takes 3 months, phase 2 takes another 3 months, and then after that they need to test the vaccine on bigger population to make sure. So it takes another 12 to 18 months to get vaccine for general population. If your coronavirus test is negative, you are safe. No, you are not safe if it's negative. When it's negative, it means at that time probably you're not infected, or the viral load is not big enough to be detected by the test. It doesn't mean in next day or so you're not gonna be infected. Anti-coronavirus drug is discovered. There is no specific medication for this novel coronavirus. However, there are some medications that have been used for different purposes before, and they are under clinical trials, like chloroquine, hydroxychloroquine, and remdesivir, and some other medications. But until the results of these clinical trials are out, we don't know exactly, but there is some good news about that. Turmeric and ginger cure COVID-19. Turmeric and ginger are good for your immune system. Like turmeric is good, it's anti-inflammatory and is good for your body. However, they are not cure for COVID-19. Drinking alcohol kills coronavirus. That is not true. When we talk about alcohol, we're talking about the disinfectant gel or liquid that you can disinfect your hands or surfaces. But it doesn't mean if you drink alcohol you don't get infected or you get better, you get cured from coronavirus. That is not true. However, if coronavirus gets into your stomach, it's going to be destroyed by your stomach acid anyway. So this is a myth. Women are strong and not affected by coronavirus. I heard that from some ladies, but this is not true. Both men or women get infected. However, men get probably more infected than women, and for some reason that we don't know why, in men, symptoms are more severe than women. Maybe it's because of more exposure of men compared to women, and because of the underlying conditions in men. That's why. But we don't know the exact answer to this question. Ibuprofen makes coronavirus 10 times worse, which we don't know exactly. There is a study from France, or report, not a study. A report from France tells that ibuprofen worsening the symptoms, but we don't know exactly, because if there is no big trial, we don't know exactly, and per just one report is not possible to say that. On the other side, if the fever is low grade, that in many cases actually is low to mid grade, you don't need to treat the fever, because fever is a defense mechanism of your immune system, and it helps your body to kill the virus better than if you don't have fever. So in low grade to mid grade fever, you don't need to treat it. However, if it bothers you and you need to treat it, you can use Tylenol or other measures. So stay positive, stay safe and healthy, and please subscribe to our channel and share it and like our video and make comments. We like to hear from you, your opinions about these videos and your questions. On the comments you can ask questions and you can let us know what are your favorite topics, and we need to know, and we like to know the stories about helping the communities, about sharing the stories if you or your family members are survivors of this COVID-19. Thank you so much for watching, and please subscribe and share. Thank you. You have a healthy life.